Welcome! The purpose of this video presentation is to shed a little more light on medical coding. The intent is not for this to replace your regularly assigned reading and other presentation materials. Rather, enhance them with a quick lecture to provide a little more clarity. Within this course, you will be introduced to both diagnostic and procedural coding. That in itself sounds a bit overwhelming. My goal is to help you understand the basic concepts so that when it comes time to apply your knowledge, you can jump right in. By now, you should have reviewed the ICD-9-CM tabbing video and completed the tabbing process. If you haven't, please go back and complete that step as we will rely on it for all of our demonstrations. As you can see, I have two reference manuals with me, the ICD-9-CM and the CPT-4. This week, the focus of our studies will be using the ICD-9-CM, but some cursory information will be of great help to you. To begin, note that procedures can be found in CPT-4. CPT-4 stands for Current Procedural Terminology. Diagnoses can be found in the ICD-9-CM. ICD stands for the International Classification of Diseases. The easiest way to approach coding and to determine if the information is a diagnosis or a procedure is to look for the what and the why in the medical document. The what is the service or encounter that was done for the patient. This is considered procedural coding because we focus on what was done to or for the patient. The why asks why the service or encounter was done and should justify medical necessity. The why is the diagnostic reasoning. Let's look at an example. Say, for instance, you took your child to the doctor because they were running a fever. The what is the service rendered, so that would be an office visit, which is a procedure. The why is the reason you took your child to the doctor, which would be the fever, which is considered the diagnosis. Okay, now it's time for you to try one. Say, for instance, you went to the emergency room and they took an X-ray because you were complaining of chest pain. Tell me what the what or procedure is, and tell me what the why or diagnosis is. If you said that the procedure was the X-ray and the diagnosis was the chest pain, then you are absolutely correct. Great job. For extra practice, think about the last time that you went to the doctor or took your child there. See if you can identify the what and the why, otherwise called the procedure and the diagnosis. So now, back to these two giant reference manuals. The what or procedures can be found in the CPT-4. Again, CPT stands for Current Procedural Terminology. The why can be found in the ICD-9-CM. ICD stands for the International Classification of Diseases. The next video in this series will help to explain what all is included in the ICD-9-CM manual, followed by how to actually look up a code.